What did the nuns used to do? I didn't go to Catholic school. They did that? They clapped? Oh, it worked, whatever. Okay. Thanks for being here. And we're very pleased tonight to have Camilla Bridge and Dr. Stephen Bridge, their husband and wife, and if I can read my own writing here. Camilla they're both at St. Joseph's College of Maine. Camilla is a biology instructor, instructor of the biology science department, to the chair, right?
Yeah.
Very good. And Stephen is a professor of theology. And since she's been there, Camilla's been there since 2010, and has done research on the impact of environmental toxins in birds, and most recently studied the impact of clean water on parasitic infection rates in rural Guatemala, among other things. I'm going to the pages. They have a wonderful resume here. And she's a recipient of the campus David Howard Faculty Award for Service Learning Excellence in 2023. And Dr. Stephen Bridge, he's been at St. Joe's since 2000, and he's taught a variety of biblically based courses on the scriptures, Hebrew scriptures, the Gospels, the letters of St. Paul, as well as Catholic doctrine, the sacraments, ethics and morality, and Catholic social teaching. Author of 4 books. I'm reading more of his, sorry. You had big words in your bio. I know the church words. But he also did an international trip service program at St. Joe's. The Spirit was spearheaded by him over 25 years ago, and there's been nearly 700 participants in that. So Camilla and Steve are married and reside at St. Joe's, near St. Joe's, with their son Gideon. And they both received the St. Joseph's College of Maine Sustaining Communities Award in 2003, which recognizes the lasting legacy of a faculty member's work partnering students with community in need. So it's very laudable work, and so we're very looking forward to your coming today. You have a little bit of competition because there's this thing going on in San Diego, the Patriots game, the Super Bowl. But anyways, we're so glad you're here today to enlighten us about the marriage of faith and reason.
We recognize that the game is today. We promised to have you out of here by 8 o'clock. After we cover a few things.
So we're going to try to use our teacher voices today because the microphone's not working. This is good practice. It keeps our voice in shape for class this week. So my name is Camilla Bridge. I am a biology instructor, the chair of the sciences department at St. Joe's, and I've been there for, it was year 16, I think. So I'm originally from Vermont. I have a background in environmental science and biology, and my sort of OG research, right? Like what I started out as studying is birds. So I'm a wildlife biologist, environmental science, but I've sort of found that I'm utilizing all the same skills to work on this project that we're going to talk about today, our work in Guatemala. So if you want to say anything else about yourself,
So I'm the chair of the theology department at St. Joe's. Camilla is the chair of science department at St. Joe's. And when I introduce that fact to my students, they usually say, "How in the world can you two be married?" And I say, "We get along very well, thank you very much." Because the Catholic Church has no problem with faith and science coming together and working together. So there's a lot of things that we could talk about in terms of collaborative projects that we've worked on, but the one that we're going to share today, I think, is a really good example of how faith and science work together to promote the common good, to advance the gospel, and to be light and salt, right, to this world.
So in just a minute, Steve's gonna talk a little bit about the sort of the biblical message of social justice and unpack some information about global inequalities. And he's going to talk about the International Service Trip Program, which he founded, and we now co-run together every year. We bring students abroad. Right now we're traveling to Guatemala, but we also traveled to Haiti in the past. And then I'm going to talk about a course that I developed that ties in the service trip, talk about our clean water project that we're working on, and then talk about this year, which was a special year for us in Guatemala. This was our 20th year in Guatemala, and so what we were able to accomplish just a couple months ago in Guatemala. So, Steve, I'll let you start.
Okay. All right. Okay. All right. So just to kind of briefly go back in terms of how I got involved in this particular project. So I went off to college, really liked theology, studied theology, and then got hired right after I graduated college. I got hired back at my Catholic high school to teach theology. It's like my dream job. I got to teach theology. I got to coach baseball. It was awesome. And so many of you know, when you have to teach something, that's when you really learn it. And so I was tasked with teaching ethics and morality to, I think there were sophomore high schools. So we were talking about social justice, and we were talking about global equity, global equalities. Let's see. Okay. So throughout the Bible, and I'm probably not telling you anything you don't know. Throughout the Bible, God calls upon the haves to share with the have-nots. In fact, we heard that. That was great. We heard that in the reading today. I could not have picked up the first reading from Isaiah. In the Torah, in the Old Testament, the laws are designed to provide economic support for the poor. In the prophets, and again, today was a great example, the first reading. Israel's future kind of depends on how well they care for the marginalized and the vulnerable, especially the orphans, the widows, and the resident aliens. So God sends his prophets to the people of Israel, and he says, hey, you take care of these marginalized groups, things are going to go well for you. You don't take care of these marginalized groups, things are not going to go so well for you. And kind of the history, as the history plays out, we see what their choices are. And then, of course, when Jesus comes on the scene, he sounds a lot like these Old Testament prophets. And most famously in Matthew chapter 25, this parable of the sheep and the goats. Pull this up here. I'm not going to read all of it, but let's see here. So the judgment of the nations. So Jesus is talking about when he comes back, the Jewish people will be judged by how faithful they are to the law and the prophets. What about the rest of everyone else? The nations, the ethnos, the Gentiles. How are they going to be judged? And this is what Jesus says. For I was hungry and you gave me food. I was thirsty, you gave me drink. A stranger and you welcomed me. Naked and you clothed me. Ill and you cared for me. In prison and you visited me. And the righteous will answer and say to him, Lord, when did we see you hungry and feed you, or thirsty and give you drink? When did we see you a stranger and welcome you, or naked and clothe you? When did we see you ill or in prison and visit you? And the king will say to them in reply, Amen, I say to you, whatever you did for one of these least brothers of mine, you did for me. And those are the righteous, right? So that's what we are all called to do. So the Bible is very consistent in terms of the haves sharing with the have-nots. All right. So in presenting this to my students, my question was, okay, so let's bring that into modern day times. Who are the haves? Who are the have-nots? And do the haves share with the have-nots? So let's take a look at that. All right. Okay. This is 2025-26 data. Now, when I was first teaching this was back in 1991, way back when. So the stats were different, but they were just as eye-opening as they are today. So this is data from the World Bank 2025. The World Bank has looked at global economies and divided people according to economic standing, economic levels. So there is the low income, there's the lower middle income, there's the upper middle income, and then there's the high income. Okay? Those are the 4 categories that the World Bank uses today. All right? And then this is the percentage that they see. About 10% of the planet lives in what they would call low income. About another 43% would fall under lower middle income. 35% would fall under upper middle income. And then the last 12% would be high income. All right. Now, this is where I want to get interactive. I hope you guys are ready to talk through something else. Okay. What qualifies as low income? So what do you think? And nobody can don't take out your phones, don't cheat on this, all right? I want to see what you think you know. According to the World Bank, so 10% of the world's population lives in a category called low income. How much is that? How much per day? How much per year do those folks live on? You can either go by day or by year. I can go with either. What do you think? Just throw out what you think.
$600 a year.
$600 a year. Okay. Is she high? Is she low? We're talking about the world. Yes, we're talking about the world. 5,000 a year?
A year.
Okay, 5,000 a year. Is he high? Is he low?
You told me this in the watermelon meeting, but I forgot.
You don't get to speak. You can stay quiet then. Don't give anything away. That's my son Gideon, just in case you're listening. All right. Okay, we got 600, we got 5,000. Anybody else? How much per year would constitute low income globally? 10%. So this would be, there's 8 billion people on the planet, so we're talking 800 million people. What do they live on a year? Low income. What do we got? Anybody over here?
2,500.
2,500? You got it in between? 300? Yeah. Okay. All right. What about lower middle income? Where's the dividing line there? Lower middle, how much per year? You know, we're talking 43% of the globe. So that's almost, you're getting close to half here. What do you think? Throw out some numbers, sure.
20,000.
20,000, okay. 20,000 a year.
8,000?
What is it?
8.
8,000? I should make you all vote. 3,000, 8,000? 35,000? Any others? All right, upper middle income. Another 35%. What would qualify as upper middle income?
Are we talking individuals or families?
We're talking individuals. Individuals. How much would an individual earn per year in order to be in upper middle income globally? 60,000. Is she high? Is she low? What other number would you have? 80,000.
35.
35,000. 20,000. Some are going higher, some are going lower. Okay, high income. What would qualify you in the top 12% globally? 100,000? 40,000? 50,000? 20,000? Top 12% globally. A million. All right. All right, let's see how you did. All right. Low income is about $3 a day, so about $1,135 a year. So 800 million people on the planet live on $3 a day or less. Okay? So live on less than $1,135 a year. All right. Lower middle income is $311 to $1,231 a day. So that puts you at 1,136 to 4,495 per year. Okay? Now, look at those populations. That means 43% plus 10% is 53%, which means the majority of the world lives on less than $4,495 per year. The majority of the world, 53%. All right. What qualifies you as upper middle income? $12 to $38 a day. So you're talking 4,496 to 13,000, so just shy of 14,000 per year. Which means if you are making more than $14,000 per year, you're in the top, you're a high income earner. You're in the top 12%. Okay, so anything more than 14,000, anything more than 13,935. All right, puts you in the top 12% automatically globally. So that means, let's see, do some quick math here. 40, 53, 63, 73, 83, 88. So 88% of the world lives on less than $13,935 a year. Okay. So I don't know if that's striking you the way it struck me when I first saw these numbers. Let's put that into local terms. The New Hampshire minimum wage, lowest minimum wage in New England. I asked my students, $7.25 an hour. I asked my students, how many of you would work those jobs at $7.25? None of my students would work a $7.25 an hour job. They would not take it. But $7.25 an hour gets you to $15,000 per year. A minimum wage job in New Hampshire puts you in the top 12% globally. And none of my students would take those jobs. They wouldn't. They'd laugh at $7.25. The main minimum wage is $14.15 an hour, which puts you at $29,000 a year. And the Portland just went up, right? $19 an hour, $39,520 per year. Average per capita income is actually about $100 a day. It's between $37,000 and $40,000 a year, which puts most Americans in the top 5% easily, closer to 1%. All right, so we know who the haves are. All right, so here's the next question: are the haves generous? Is the U.S. a generous country? When it comes to global inequality, are we generous to those who have very little? What do you think? I see some people shaking their heads no. Anybody shaking their head yes? Yeah. What do you think?
Yeah, I think so.
You think so?
I think the majority of the aid that goes to impoverished countries comes from the U.S.
Okay, the majority of aid that goes to impoverished countries comes from the U.S. Okay? All right? Other thoughts?
I think there's proportions of our country that are very generous, and then there are some that are not. I don't think you could lump it all into like the United States. I think there are many religious folks who give their entire lives, right? But then you have some that wouldn't donate at all. So
Okay.
it's hard for.
If we took everything that the United States, everything that went out of the United States in a given year, government, non-governmental, private, even nonprofits, individuals that went to aid in developing countries, and we put a dollar sign on that, how do we stack up against other countries?
I
Yes.
think we would need to compare it to the income of the U.S. and the income of other countries. Like,
Okay.
how much do we give based on what we have?
Okay.
And how much do others give based on what they have? I know that some very poor communities give to their neighbors or give to other people in far more generous ways than I often.
Okay. That's fair. We'll get to that. But that's not what I asked. If we took net dollars in a given year, how much does the United States give? Where would we stack up against other countries?
Dollar for dollar?
Net dollars given away per year. Where would we stack up in the list?
In the middle.
In the middle? In the top, yes?
Like war money, like the Ukraine?
No, we're talking about, no, not military aid, but we're talking about humanitarian aid. Humanitarian aid.
I see a problem looking at individual countries in Europe. If I looked at the European community, I feel I could compare to the United States, and maybe that way we would be giving more in Europe collectively.
Okay? If we looked at what each country gave in net US dollars, where would the United States fall on the list?
I would think high.
You would think high. How high? Yes. You would be right. You would be right. Yeah.
Number one.
Number one. United States is number one in gross spending, about $35 billion a year. So is the United States a generous country?
Yes.
By that measure, we are the most generous country in the world. USA. USA. All right. So there we go. We're a generous country. We can pat ourselves on the back. End of discussion. Right?
No.
Right?
No.
No. Why are you shaking your head no?
Because you have to get the money that you have available versus what you give. And that's where that ratio is so important.
Okay. All right. So if Camilla decided she wanted to run a race, a 5K charity race, and she came to Gideon and she said, Gideon, will you sponsor Mom?
Sure, I'll sponsor.
How much you gonna give her?
I'm not very good at, I'm not like out in the public, like I don't have a job and stuff. Free money.
Just give me a number.
$100.
$100. Okay. All right. So you're gonna give Mom $100 to run her charity event. All right. So she asked me, will I sponsor? Sure, of course I'll sponsor you. How much did Gideon give you?
$100.
I'll give you 101. All right. Clearly, I am the more generous individual. I just gave her $101. Gideon gave her $100. Right?
No.
Right?
No.
All right, most of you recognize Gideon probably only has $100 in his bank account, if that, right? And hopefully I have more than that in my bank account, right? So it's not just a matter of net dollars, but it's relative. Okay, so one way of measuring that is a percentage of your gross national income. How much does the country bring in a given year? And then based on that, what percentage do you give away? Okay. In fact, there's a biblical benchmark there. It's called the tithe. In the tithe in the Old Testament, they were required to give away 10%. So when they brought in their harvest, okay, they're supposed to take a stock of all their harvest, and they're supposed to give back to God 10% of that. All right. How much, what percentage of our gross national income do we give away? Is it more than 10%? Is it less than 10%? Where are we on this?
Less. A lot less.
We're a very generous country. 10%, anyone?
No.
3%? 5%?
One.
1%? That's not very generous. Less than one? All right, let me ask you this. So, if we rank order countries by percentage of what they gave, the United States is no longer at the top. Who is at the top? Ooh, good question. Who ranks number one pretty consistently year in and year out? And they take great national pride in this. They give away the highest percentage of their gross national income than any other country on the planet. They take great pride in this. Anybody know?
Philippines.
It's not Canada. Sweden is close. It is a Scandinavian country, Norway. Yes, Norway takes great pride in this. They are number one. They are the most generous country by this measure, okay, by what you have. And remember, this is sort of the measure Jesus is talking about, right? remember when he's across from the temple and all these people are putting in all this money into the temple treasury, and then this poor widow comes and puts a few coins in, right? And Jesus says she's given more because she's given a higher percentage of what she has, right? So Norway gets it for what? How much do they give away of their gross national income per year?
115.
They are number one in the world because they give away, are you ready? Are you all sitting down? You are sitting down, this is good. Just over 1%. Just over 1%. United States is nowhere near this. The U.S. spends about 25%, or 0.25% of our gross national income. So in real world dollars, that means for every $100 that we earn in the United States, we give away about 25%. So by that measure, are we generous? No. Yeah, not so much. So these are things that I learned as I was teaching. I was presenting them to my high school students. And again, this isn't just a government thing. This is a private sector thing too, right? If we did a financial analysis of everybody sitting in the room right now, we would expect this result, all right? And so, you know, I asked my high school students, you know, why aren't you more generous? You know, I mean, they watch television, they see there's issues going on in the world, they see there's poor countries. Why aren't they sharing with them? What did they say? What was their number one excuse?
They didn't have money.
They didn't have money, exactly. That was the first thing they said. As it turns out, high schoolers have the highest percentage of disposable income of any demographic. Because they have jobs and they have no bills, right? So we knocked that one off the table right away. Yeah. And then what was their next? What was their next excuse?
Didn't know how.
Well, I mean, I said, you know, there's Red Cross, there's, you know, Feed the Children, there's Catholic Relief Service, there's all sorts of, I mean, they're aware of these things.
Saving for college.
Someone else.
That's not what they said. Not saving for college. Why didn't they contribute to these things?
Spring break.
Not spring break.
Because their parents did.
No?
They didn't know where to give it.
No, they knew where to give it.
They didn't think it would have an impact?
It's not so much that they didn't think it would have an impact, but you're getting warmer.
Nobody asked.
What's that?
Nobody asked.
No?
We thought someone else would do it.
No?
Trust.
Trust. We don't, you know, we give this money to Red Cross, we never see it, we don't know if it's really going to get to the people that need it, and, you know, that's the excuse. So I said, okay, well, what if I could guarantee that 100% of whatever you gave went directly to someone in a developing country for food, clothing, shelter, or medicine? 100%. How generous would you be then? They said, well, we'd be very generous, but you can't do that. And I said, watch me. So this is what we did. I did a little challenge with my students. I had 150 students, and I said, all right, $10 a person. We'll set a target. 150 students will set a target of $1,500. That's your end of the bargain. If you raise that money, then I will, for my part, pay for all my expenses, take it to some developing country, and make sure that 100% of it goes to food, clothing, shelter, medicine, whatever. They said, well, what if we fall short? I said, then we'll send it to the Red Cross or whatever, Catholic Relief Service. They said, all right. So I gave them 10 weeks to do it. We had the little thermometer in the classroom. We, you know, I had a little jar on the desk. Each day they come in, they donate. It only took them 8 weeks to do it. So they hit their goal. The rest of the school found out about it. They each contributed. They said, hey, can we contribute too? I said, sure. We got another 500. There was 2,000. Word got out in the press. Is this down here? Yeah, there it is. There's 23-year-old Dr. Bridge. And the rest of the community funds started pouring in. So all of a sudden we had $5,000 to go and spend. So I chose Haiti. Haiti has the distinction of being the poorest country in the Western Hemisphere. There are poorer countries out there, but they're a lot farther to get to. So we decided Haiti would be a good choice. And so I took the $5,000, I went down there, I went on a spending spree, I took a video camera with me, I filmed everything, brought it back, showed the students, they loved it. They saw the real world impact that they had. We built a house and we put 20 people on a feeding program for a year. And they saw that. They saw these people and so they were psyched. They're like, can we do it again next year? I'm like, all right, let's do it. So we did it again the next year and the next year and the next year and the next year. It just kept going on and on. So I left that high school, went on to grad school, and then ended up at St. Joe's in 2000. Wanting to do kind of the same thing, wanting to bring that type of activity to St. Joe's. The problem with college students is it's very difficult to fundraise among college students because they're taking on a lot of debt and they don't feel like they have a lot. The advantage of working with college students is I can take them there. And so that's what we did. So in 2003, we did our first trip, our international service trip to Guatemala. And then in 2005, 2006, we did our first international service trip to the second poorest country in the Western Hemisphere, which is Guatemala. Sorry. Haiti first, then Guatemala. Yeah. So Haiti first team, 2003, 2004. We did 12 additional teams since then. Guatemala was the first team, 2005-06, 26 additional teams since then. So as Father mentioned, we've had over 700 participants so far since we started this. So they get to go down there, they get to work. We build houses, we build dental and medical clinics, we've built what else? We've worked with child sponsorship programs. Oh yeah, sorry. Oh yeah, there we go. Okay. By the numbers, here we go. Yeah, 38 teams total. Yeah, the participants we need to update that. 15 tons of humanitarian supplies, 75 houses worked on, 10 latrines dug, over 10,000 patients seen, 2 medical clinics built, 1 art center. The Lapidary Art Center. 3 community centers, over 50 children sponsored, tabletop wall, everyone will talk about. So yeah, a lot of good stuff. Children's programs, soccer games, lots of soccer games. Lots of soccer games. So, yes.
I just want to say I went in 2008, so I was one of the first teams to go.
Right, and did you go to Haiti or Guatemala?
Guatemala.
Guatemala, right.
You were on sabbatical that year, so I wasn't with you.
Oh, okay.
It was an awesome
Yeah. Well, thank you for going.
Yeah.
You're welcome to come back anytime. Love that. So then in 2010, Camilla came to St. Joe's and you got involved. When was your first trip?
2011.
2011. I talked her into it, roped her into going.
Literally, Steve and I met at a St. Joe's Christmas party, and the first thing he said to me was, "Hey, do you want to go to Guatemala?"
She's like, who is this guy? What is he doing? So we've been doing that, but then to introduce kind of the science piece and how the science piece has really taken these trips to the next level, and I'll let you talk about that.
Yeah, so I get my best ideas when I'm exercising. So I was like running, and I was like, oh my gosh, I want to in my department, we have a lot of students that are interested in going to healthcare in some way, shape, or form. They want to be physician assistant, doctors, optometrists, like you name it. So I really wanted to create an opportunity for students that are interested in that area to come to Guatemala and get some hands-on experience doing public health in this community. So I developed a course called Public Health in a Majority World Country, which is a different kind of term than a developing country or even a third world country. You may have heard those terms before. What I love about this is exactly what Steve said. Guatemala is very much like a country in the world where the majority, how the majority of the world lives, which is in a low income setting. So Guatemala is a great model for examining what sorts of issues most people in the world face. I wanted to mention that this course is an example of Mercy in Action at St. Joseph's College. So we're sponsored by the Sisters of Mercy, and we take great pride in that. This particular experience, this service trip and this class is rooted in the corporal works of mercy. It educates the whole person, have value-centered commitment to social responsibility, and prepares students to serve both organizations and communities. I threw in our St. Joe's vision statement here because I really love it. So we strive at St. Joseph's College to welcome everyone into our community because everyone has that innate dignity. They're a reflection of God. That form individuals who practice humility, justice, and compassion as Jesus did in solidarity with the marginalized. That's what we strive for at St. Joe's. Like that's what our goal is. So this is a course that I would say is an example of this. So very briefly, these are some outcomes of my course. We examined health disparities between majority and minority world countries using the United States as a model and Guatemala as a model. We learned and utilized some basic epidemiological skills. So this is how we track disease and other things in the population. We work with a community partner called Partners in Development, and we've been working with them for the entire 25 years of the service trip experience. So we're best buds. So we work with them to develop a public health project that is going to benefit their community. It's really important for me to say, how can we serve you? What do you need? Instead of being like, hey, I have this idea, I think you guys could use whatever it is. And because the community knows what they need. The community wants to thrive and the community wants to prosper and be healthy and happy. So they tell us what we need and we're like, okay, we're gonna do it. We do some statistics, right? Like this is science and math are married, just like Steve and I. So we utilize statistics to analyze data, and then we communicate our public health information in a community forum that we invite the entire campus to. We invite our Guatemalan community members to attend remotely, and we show them what we found. So this past year, I guess it was 2 years ago now, Tally is the president of Partners in Development. I said, Tally, what can we do for you this year? And she said, I really want you to come test the drinking water to see if it has parasites in it. And I said, yes, we can do that. And then I took a deep dive into figuring out how we were going to do that, and I figured out that it's really actually not that easy. So what we did was, well, I'm going to unpack that in a minute, but she wanted us to assess the drinking water to see if there's parasites in it. In the community where we work, everyone has parasites. And when I say that is when they do a parasite screening of the community, 100% of the people have parasites. And we believe that is in no small part because to the water that they're drinking. No one there has access to clean water, unless they're gonna pay for bottled water, which most people can't afford to do. And the other thing is that she wanted us to figure out a system, a way that we could bring clean water. So they had sort of like filtration units that they used in the past, but they were really difficult to maintain, so people didn't use them the right way. They weren't effective. So those were her two asks. I want to talk just a minute about the low income category that Steve mentioned. Low income is also referred to as extreme poverty, and that it's a cutoff of living on $3 or less a day. So the people that we serve in the community where we work, many of them live in extreme poverty, and the goal of our work and PID's work is to bring people out of extreme poverty to regular poverty. Because even just moving out from that low income to the, middle low income, that has huge benefits for people's lives and for people's health. This is an example of a home of a person that lives in extreme poverty. So what you'll see in this is the walls of the house are made out of rusted corrugated metal. You can see there's rusting through. There's a dirt floor in this home. This person is cooking very close to the ground. And they have a tarp for a roof. And this is like fine if it's not raining, but the rainy season in Guatemala brings flooding into people's homes, makes people sick. This person is also cooking inside their home over an open flame. So imagine if you had you didn't have a stove in your house, you had to cook on an open flame, and your house filled with smoke every day, and you breathe that in. So this is a very typical a home in the community where we live. So extreme poverty comes with low income, hunger and undernutrition, unsafe drinking water. I highlighted that because that's what I'm going to focus on here. Lack of access to basic health services, unsafe housing, illiteracy, and premature death. These are all things that are associated with being in that extreme poverty category. So why is clean water important? In this community in particular, unsafe water can increase exposure to harmful microbes like bacteria and parasites. So this is roundworm we have here, and then also human whipworm in one of their life stages. These are two parasites that I'll revisit in just a minute, but these are two of the parasites that we're tracking in drinking water in this community. So when someone has parasites, the symptoms are diarrhea, fatigue, weight loss, vomiting, skin rashes, among other things. When an individual is chronically infected with parasites, their body is not able to absorb nutrients the way it should, which is especially harmful for developing children. So when children are chronic loads of parasites and they're not absorbing nutrients the way they should, it leads to stunting, which is a condition where children do not grow to their potential physically and or cognitively. And it's because of perpetual undernourishment. So stunting happens when children are malnourished for a long period of time. I'm going to skip over the cycle of stunting there, but let's take a look at a few maps here. I don't know if you all can see this dark spot right here. Guess what country that is? It's Guatemala, okay? So down here we see, this is the percent of children in each country that have stunting. So Guatemala has some of the highest rates of childhood stunting in the world. It's a heartbreaking statistic that almost half of children in Guatemala are physically or mentally stunted. It's unnecessary. It's heartbreaking. So our hope through this course and this project is to provide clean water. We're hoping to break the cycle of stunting. And if we can alleviate the parasite infection issue in the community with clean water and education and also medication, then a child can grow up to reach its full potential and become the best father that they can be, the best income provider. They can be a mother that has a healthy pregnancy and has a full weight baby that has a good head start in life. So this first round when we went down 2 years ago, these are my students in my public health class, we provided hygiene education. So educating the community about like where they might be exposed to parasites and how to prevent that exposure. We, show and tell. We provided bucket filter units from Sawyer. So some of you may have heard of this company before. Sawyer makes backpacking filters. So any of you who are like outdoorsy camping type people, like you can hook this up to like a water bottle full of lake water and like drink, like squeeze it through the filter and drink it. So Sawyer has a humanitarian arm, and they create these kits that is like, it's just like these pieces right here. And then all you need is a 5-gallon bucket, and you can convert this. This is a gravity-fed water filtration unit. You can fill this with water from anywhere, and it will filter out 99.99% of bacteria and parasites. These are super easy to maintain. All you've got to do is back flush this with a syringe or a water bottle, and it's clean. And if you take care of this filter, it can last for up to 10 years. The cost of one of these is around $30 US. So 10 years of clean water for an entire family for $30 is a great investment. So we handed these out, 50 of them the first year. We also analyzed some parasite data from the medical clinic that's in the community. Partners in Development runs a medical clinic that provides free medical care to everyone. And we used eDNA techniques to identify parasites in drinking water. So here's some stuff that we found. We found that 100% of the people who were surveyed for parasites had them. We found that I think it was 50% of people had at least one parasite. I believe it was like 30% of people had 2 parasites, and then the last percentage of people had at least 3 parasites. So everyone's infected with parasites here. This graph shows the sort of orangey red colors. Those are pathogenic parasites. Those are parasites that will make you sick. The green ones are just sort of like hanging out in the background. They're not necessarily going to cause any harm to you. This is a sample size of 50 people. Alongside that, we collected some drinking water. This was a very preliminary study that we did. We collected drinking water from 5 homes. And my coworker, Dr. Lucas Bernacki, who's a geneticist, used eDNA techniques to look for the presence of the pathogenic parasites that we found in the fecal samples. So we had 5 samples. We had municipal water. We had some well water here, and then we had some water from the river, because some people do use the river is some people's drinking water source. These are the parasites that we found in the drinking water. We found evidence of their DNA in the drinking water, I should say. So roundworm and human whipworm were the two that stood out to us as the most prevalent. And then this is fecal data from individuals that live in those homes. So that was sort of like a trial study for us. So this last year, Steve uncovered a great funding opportunity that we shot for the moon. The Sawyer company has a foundation called the Sawyer Foundation. So the owner of Sawyer gives away 90% of his profits to do these clean water projects around the world. So they have a grant process, and so Steve reached out to them and sort of explained our project, and they were like, hey, well, don't fill out the whole application, but just let us know like what you're interested in doing. So Steve like filled out some stuff, and they were like, here's the full grant amount. Like they were like, here. So they gave us $25,000 to bring more clean water to the community. So we did that for our 20th anniversary. We were able to bring down, let's see, a lot more of these bucket filter units, which I'll show you a picture in just a second. This is Gwen Laughlin. She's from Sawyer Foundation. She just happened to be visiting Maine right around the time that they gave us a grant, so we invited her to campus. This project is also really exciting for us because it's a partnership with Sawyer, but it's also tying in some really amazing alumni that have gone on service trips during their time here, and the experience so profoundly impacted them that they have incorporated it into their career. So one of those alumni is Bobby Mishu. This is Dr. Bob right here. So Dr. Bob went to Tufts University for med school, and he is a primary care provider at Maine Health and has chosen to work with a lot of the immigrant population, low-income people in Maine. He specifically chose to work with that population because of his experience in Guatemala. But he is now bringing his own medical residents with us to Guatemala. So they're providing medical care down there and also helping with this research that we're doing. So this year we brought down 500 filter units, and they're all spoken for. How many did we distribute? 250. 200. We distributed half of them while we were down there, so this would have been right before Christmas and right after the New Year. We also provided education and training about how to use and maintain the filter. It's really important to make sure that people use the filter correctly and to follow up and see if they're having issues, because otherwise if you just drop and go, then it's like, oh, we did something nice, okay, bye, like we have to make sure that they're utilizing it to get the good health outcomes that we're hoping for. So this is a group, this is one of our, she works at St. Joe's, but she's an alumni too, Emily. And Juan Carlos was our translator, and they're doing like an education session for some women who are using buckets. The other piece that we did was a lot more water sampling. So we're really interested in looking at what's in people's drinking water, what is the filter filtering out, and what is the filter, like what is the water coming out of the filter have in it or not? We're hoping nothing. So we sampled water at 18 homes. So this is one of my students, Emma, taking some water from a filter in a home. And then the process of looking for parasites in water is this. You take a big volume of water and then you filter it through a filter. So that's what we did. This is Ian. He's using a hand pump to filter the water through the water samples. So these are our water samples right here. And afterward, this is the junk that was in the water. And this is on a piece of filter paper that we can like take back to the United States. So we kill all the microbes in the sample, and then we bring it back to the United States. And my coworker, Dr. Bernacki, is looking for the presence of the parasite DNA in those samples. So eDNA is a really cool technique. You can look for basically like anything that was ever in the water. You can take a sample of water, you filter it through, and then you use little segments of known DNA. So like we have a segment of the parasite that we're looking for, and he has all this fancy equipment. Don't ask me, I'm not the geneticist here, okay? And he can use his technology to say like whether or not the known DNA is found its target in the water. So he can say like, here's the parasite DNA. Has it attached to something in the water sample? And if yes, then that's a positive for that parasite species. He's using like fluorescence techniques, like it's so cool. So there's a lot going on. This was a huge year. It was like I think Steve, I think you would agree, like this was the most work I've ever done on a service trip. But it was such good work. So as far as next steps go, we would really love to expand clean access in this community. They are so excited about the bucket filters. Like they're so excited to have this, to have clean water and to have it be like solo maintenance. We would really love to surround the children in the community with clean water access everywhere. So I would love to bring some of these filters to the classrooms in the community and the churches in the community so that when they're like in their classroom, they can still have access to clean water. We want to continue assessing parasites in the community, so we're hoping to do follow-up fecal screenings of parasites to see if the clean water is impacting infection rates in the community, and continue our study of the Sawyer filter efficacy. So those are sort of like, we have lots of ideas, so that's sort of what we're thinking is going to be next up. I'm gonna stop there. I want to say like, as a scientist and a Catholic, like this is my prayer, right? Like this is me using my faith and my skills to help marginalized communities. The beauty of this experience for me as an educator is that our students that participate in this experience are forever changed. And they bring this experience with them into their practice, whatever they do next. It's always going to be there, because once you experience the way that the majority of the world lives, you look at everything differently. And so as an educator, that is like, it's the most amazing experience to be part of that journey with my students. I'm just really grateful that Steve invited me at that Christmas party that one day. Steve, I'm gonna send it back to you for maybe some final thoughts. Look how young we are.
Yeah, so I know the theme has been kind of marrying faith and science. This is one example, and we could give others, but just that's an example of the collaboration. And again, that the Catholic Church is fine with science. Science is a tool, and it's a great tool that can be used to improve our world well-being of others around us. And, find better ways to feed the hungry and shelter the homeless and clothe the naked. And I mean, that's the best use of it. So, that's what we've been trying to do. Yeah. So, at this point, how are we doing on time?
We're at the end of our time.
Okay.
I just wanted, this picture is beautiful. I was like, the Catholic audience will appreciate this. This is a church on Lake Attilan, and these are some indigenous women who were singing the rosary when we went to visit, and it was just so beautiful. This is Christmas time, so I wanted to share that photo too. Deep faith of the Guatemalan people. We're happy to answer any questions. Yeah.
Where is the community where you go?
Ixtacapa is the name of it. It's about 3 hours southwest of Guatemala City. Mazatenego is the nearest big city in that area. So it's kind of in that region.
Is there a way that we as a parish and we as people can be helpful?
I would say, yes, absolutely. If you want to support this work, like 100%, we would welcome that support. I think there are a couple ways that could sort of play out, and that would be maybe like funding's the bucket filter, but also another thing that we're thinking about is right now the students that go on the trip, they have to pay out of pocket for that, and we try to keep the cost as low as possible. I mean, like, they're literally only paying for like airfare and lodging, and it's pretty inexpensive, but it's still a barrier for some. And so we're trying to, we would love to have like a scholarship fund for students that would want to go on that experience, because it's like, once you send that student on the trip, then they talk to other people. It's like it spreads, right? So the more students we can get down there, the more awareness there is about those majority world people. Yeah.
There's also, again, we work with Partners in Development. They're on the ground 24/7 down there. They have child sponsorship programs, small business loan initiatives. I mean, there's other ways of getting directly involved in those ways as well.
If any of you are interested in talking to me after, I have, come chat with us.
Yeah.
We can give you like more concrete contact information. Yeah. In Guatemala? So in Guatemala, most of the kids in the village go to public school. And then Partners in Development actually has a community center where they do tutoring, and they have a computer lab. So the children will end up there after school too for help with homework. Yep.
Do they tend to grow their own food, and are they using the water that's filtered? Or
Yes, that's a great question. That was part of our education.
Yeah.
So some people grow food. A lot of people, I think, get it from the market. But in all food preparation, unless they're really like boiling the water, one of the pieces that we're trying to stress is like rinsing your vegetables and stuff with clean water. Those are the types of little things that can really like limit the exposure to parasites. Yep. Yeah.
Do they have access to medication? Like, once they have clean water, 100% of them have parasites?
Yes.
What?
So Partners in Development is a community hub. They've been down there for 20 years. We were actually, St. Joseph's was the first group ever to go down to this community 20 years ago, but they have a medical clinic that has a physician that comes once a week, but they have a nurse there, they have a pharmacy, and it's free to anyone who comes. They provide basic medical care and medications, like if someone came with symptoms of parasites, they'd be able to get anti-parasitic medication. Anything that's like a bigger medical need, they get sent to like a local hospital, but they're able to do a lot of really important preventative care just in the community. Yeah.
So with the anti-parasite medicine, they can knock it out, but that's a temporary fix,
Yeah.
because the next drink of water they take, it's going right back in, so that, yeah.
Wanted to add that, like, the medical care that is provided in that clinic can be really saving for some people.
Yeah.
One lady, I was actually had an antibiotic, she almost died from it.
Oh my God.
That was
100%, and that's like a whole other presentation that we could do, is like the types of medical issues that we don't really think twice about that can really impact someone's life in a community like this, because they lack all of the other resources to stay healthy. Yep.
Yeah.
So there's a clean water program produce changes in the health of the community?
That's a great question, and that's what we're studying right now. So we have some anecdotal stories. I can share an anecdotal story with you, which is fantastic. We're also doing the science that we're doing is hopefully going to be able to track whether or not that's happening at a community level. But I'll tell you a story about a little boy who I visited their house to sample water in December, and Monica, who's the program director down there, was telling me about the little boy. He was like running around like, like whatever. They're on break when we go down there in December, like that's their summer break. So all the kids are like running around. And Monica said, you wouldn't believe how sick this boy was last year. They were one of the original recipients of a bucket filter. And this little boy was so sick, he came to the clinic, and his hemoglobin level was 4, which is like, you're gonna die soon. Like, you need to go to the emergency room. So they brought him to the hospital and got him medication to get better, but in the meantime, they've also received a bucket filter and have access to clean water. And Monica's like, you can't even believe how much healthier this child is. He's growing, he's thriving. But I will say that one sad thing I learned is that he missed so much school that he's like, I don't want to go back to school. Like, I miss so, like, this is one of those right? This is like one of those side impacts of being sick and not having access to clean water. This kid was sick, he missed school, he doesn't want to go back to school, so I hope he goes back to school.
Well, they put him in the tutoring program. Now they're getting in contact.
Yeah, so it's hard. But yes, anecdotally, we have a couple stories like that, which are really, really hopeful. Yep.
Thank you so much for this amazing presentation. We have a kid coming in here. Maybe we can have you back.
If you have any other questions, feel free to just come up, we'll be here for a while.